Hello dear GDC aspirants, welcome back to GDC class English and especially welcome you all for the specially designed master stroke series for MRP pharmacist notification from Tamilnadu. Yes, so till now we have uploaded so many videos regarding this series. Okay, so if you have not watched, go and watch all the videos we have made. And yes, and there are no so many videos are coming on the way. Yes, now today in this session I'm going to solve the another important MCQs coming topic called basic principles and all the traditional systems of medicine. In the pharmacognosy, TSM, traditional system of medicine, is one of the important topic, right? From this also we can expect most number of questions. So for that reason, we are going to solve the most important MCQs from this topic. Yes, without any delay, let's start today's session. Okay. Yes. So all the questions related to these topics, Ayurveda, Siddha, Unani and Homeopathy and their preparations. Okay. Yes. First question of the series is, what does the law of simplex mean in homeopathy? Yes. So the law of simplex, there are 7 to 8 principles in the homeopathy are there. In that, one of the principle is law of simplex. So what does it mean? Using a combination of remedies to treat a disease. So one single simple medicine to be administered to a given case at time. Use a remedy that produces multiple symptoms. Use a remedy that no known effects. What is the right answer? If you have gone through with her homeopathy or different systems of medicine, it is very easy to answer this question. Simplex. The name itself tell you. Okay, simple. Simplex. Simple dose is enough. One simple and single dose is enough to treat a case. That's their main principle. And these are okay. So and this system was developed by a German physician called Samuel Hahnemann. Okay, and he wrote this and he developed this system based on one principle called law of similarity, which means fundamental principle of homeopathy. Okay, and yes, the law of similarity nothing but like can be cured by like cures like, that is known as similia similibus currenter. But in this, he included several theories, that is law of simplex. Okay, simple and single drugs should be prescribed at a time. That's the one principle. Okay, law of potentiation is there, law of similarities is there. Okay, law of simplex, law of individualization, potentiation. All these principles are there. Okay, but thing is, here the Samuel Hahnemann is the father, and the law of simplex means simple and single dose should be prescribed at a time. Panchamahabhuta and Tridosha theory related to which system of medicine? Very familiar theories. Homeopathy and Ayurveda. Chinese. Homeopathy, sorry. Ayurveda and Unani and Ayurveda only. Yes, undoubtedly option D is correct. Yes, because Panchamahabhuta and Tridosha and Saptatatu theory are belong to the theory of Ayurveda. Okay, they are the basic principles of Panchamahabhuta theory, Tridosha theory, Saptatatu theory, and Panchsheel theory is also belongs to the Ayurveda. Okay, yes. Next, which of the following is not the element of Tridosha theory? Which of the following is a Tridosha theory? Tridosha means three elements of our body. So if there are any imbalance between these three elements, then it can be considered as a disease condition. If they are in equilibrium, he is known to be the healthy person. Okay? Yes. So what is the right answer? Undoubtedly, your option D is correct, because Teja is not at all included as a Tridosha, but Teja is one of the part of Tridoshas. Okay? Clear? But Vata, Pitta and Kapha are only the Tridoshas. Clear? So Vata, Pitta and Kapha. Teja is a part of Panchamahabhutas. Yes. So which of the following indicate the potency of drug? According to the Panchsheel theory, in Ayurveda, which of the following indicates the potency of a drug? Option A Rasa, B Guna, B Virya, C Vipaka, D Vipaka. What is the right answer? Potency. Potency means Virya. In Ayurveda, Panchsheel theory is there. So Panchsheel means 5 properties of the dosage form. So yes, Rasa means taste, you can say taste or essence. Guna means properties or qualities. Virya means potency or energy. Vipaka means the post-digestive effect or metabolism. Okay, Prabhava means specific action or effect. Next question. The literature of Siddha system is in which of the language? Option A Telugu, B Tamil, C Tulu and D Sanskrit. Siddha system. Okay, Siddha. Okay, Agastya is the father of this system, but the literature will be in Tamil. Okay, so each system is originated from different location, and it is written in a different languages. Ayurveda is written in Sanskrit language, and Siddha is written in Tamil language. Okay, Unani system is written in Islamic language. Okay, so like how all system has been written in different language, and yes, the literature will be in Tamil. Okay, yes, the Siddha system of medicine is written, mostly Siddha system is written in Tamil language, and says Agastya is known to be the father of this medicine. And what is the name of the first recorded book on the concept and practice of Ayurveda? Okay, practice of Ayurveda. Which book? Sushruta Samhita, Charaka Samhita, Ayurveda Samhita, or Hindu Samhita? No, never. We know that obviously, undoubtedly, option B, Charaka Samhita. He is an important person, who worked on Ayurveda. Okay, and whereas Sushruta Samhita is a book written by the Sushruta, where it includes the 760 herbs, but the mostly it describes about the surgeries. Okay, yes. First ever book recorded is Charaka Samhita, that is in the 1900 BC. Okay, and yes, Ayurveda is part of Upaveda of Atharva Veda. So from the Atharva Veda, Ayurveda is derived. Yes, and yes, then this Ayurveda important book, first ever recorded book is Charaka Samhita. Okay, yes. Next, fundamental principle of homeopathy involves the law of similarity, minimum dose, totality of symptoms, and all of this. I said already in the first slide. Okay, so it includes all of these principles because there are 7 to 8 principles are there. Law of similarities also belongs to that principle. Minimum dose, totality of symptoms. Okay, so all these are principles of homeopathy. Okay, like use like, but the fundamental principle is like use like. But the fundamental principle is like use like. Concept of individualization, principle of similarity or law of similarity, principle of simplex, minimum dose, law of proving, law of dynamization, vital force, acute and chronic disease, and direction of cure. So all these are the principles of homeopathy. Next question, what are the main components of avaleha or leha preparation? Kashaya, jaggery and powder drugs, ghee, oil, honey only. Kashaya, jaggery, powder or pearls of drugs, ghee, oil or honey. Sugar, sugar candy and water only. Okay, so each combination and each preparation, okay, describes about the real components of the dosage form. So what is the right answer? Option C, Kashaya, jaggery. Kashaya means decoction, jaggery, powders or pulp of drugs or ghee and honey. Kashaya means C, decoction. Clear? Yes. So avaleha or leha, semi-solid preparations of drugs prepared with the addition of jaggery, sugar and sugar candy, boiled with prescribed drug juice or decoction. That's it. Next question. Ayurveda is an which system of medicine it was? Ayurveda. It's a very, very simple question, right? Ayurveda is an Indian system of medicine. Even the Siddha is also Indian system of medicine. Clear? That's it. Ayurveda is an Indian system of medicine. You know that Ayurveda is an Indian medical system or Indian system of medicine. Okay, and Veda, Ayur means life, Veda means science. That's the reason it's known as ancient science of life. Next question. Sodhana is another name for. Sodhana is another name for. Actually, it's a process of calcination, but Sodhana, not a calcination. So Sodhana is another name for filtration, purification, maceration, and distillation. Sodhana. Okay. Undoubtedly option B, purification. Okay, Sodhana means purification. So Sodhana means the process of purification called as Sodhana in Ayurveda. Okay, and purification process of different types depends on the type of drug. Okay, one is Samyana Sodhana, another one is Visesa Yodhana. Okay, yes, there are two different processes there. Samyana Yodhana, Samanya Sodhana and Visesa Sodhana. Sodhana means purification. Next. In Siddha system of medicine, identification of causative factors of disease is done through. How can you identify the causative factors of disease? Either pulse reading, color of body, urine examination, and all of this. Yes, undoubtedly, diagnosis of the particular drugs can be done by all of this. In any system, we can assess the person health by all the common diagnostic methods only. Okay, you can see. So, Siddha system of medicine, we know that it is written in Tamil. Okay, the person who practices the Siddha system called as Siddharth, and says Agastya is known to be the father of this Siddha system of medicine. Okay, and yes, that identification of disease can be done through pulse, urine, eyes, and all the normal factors such as tongue, voice examination. Okay, color of tongue, all these things. Normal diagnostic methods. Next, which of the following traditional medicine is a liquid dosage form? Thaila, Vati, Kalka, and Avaleha. Which of the following traditional medicine is a liquid dosage form? Liquid, they are asking. Okay, undoubtedly option A is correct. Vati means tablet, Kalka means, okay, one of the decoction. Okay, Avaleha means Avaleha means semi-solid. Kalka is also semi-solid. Okay. Kalka is also semi-solid. Avaleha and Kalka is also semi-solid. Whereas liquids are Thaila. Okay. Which of the following traditional medicine is a semi-solid dosage form? Asava, Sattva, Avaleha and Vatika. Just now we have came across. What is that? Undoubtedly, option C is correct. Avaleha. Okay, Avaleha is a semi-solid dosage form. Okay, you can see here. Semi-solid Avaleha, Grita, Kalka. Okay, and Bhasma, Churna, Parpati, Rasayana. Arishta, Arka, Asava, Swarasa, Taila. These are liquids, and solids are tablet, Gutika and Vatika. Yes, next question. The Ayurvedic dosage form from Guttika Vati means medicated ghee and oils, tablets and pills, eye preparation and powder. Just now we have came across already in the solid dose forms. We have seen that examples. Okay, undoubtedly they are meant for the tablets and pills. Gulika, Vatika and Gutika means. Okay, Vatika and Gutika means tablets and pills made of mixtures of therapeutic ingredients from plants, animals and minerals. Okay, so these are examples. Siva, Gutika. Okay, and yes, Vati. The Ayurvedic dose form, which is prepared by repeatedly boiling the decoction and condensed with the jaggery and sugar, is called as Arista, Asava, Avaliha and Anjana. Okay, here the decoction condensed with. So what is the right answer? So Avaliha. Okay, Avaliha. You can see Avaliha has been prepared. Okay, it is a semi-solid mixture of drug prepared by the adding either sugar or jaggery. Okay, prescribed or drug juice or decoction. Okay, and these two are boiled together to form a thick and sticky consistency. Okay, Suvarnavaliha, Bilvavaliha, Vasavavaliha, Drakshavaliha are the different examples. Okay, yes. Next, powder of substance which is obtained by the calcination. Obviously, calcination is process of getting ash. So, obviously, option A, Bhasma, B, Churna, C, Vati and D, Lepa. Okay, so option A is correct. Calcination is nothing but a process of preparing or process of getting ash. So, Bhasma is nothing but an ash. Okay. As calcination of metals and minerals and animals products, Bhasma. Okay, Bhasma is made out from the calcination of metals, minerals and animals and products. Clear? Yes, it is a process of preparing Bhasma. Next, the quality of drug is represented by its taste is. Quality of drug is represented by its taste is Guna, Virya, Vipaka, Rasa. So what is the property here? Obviously we have discussed Panchsheel theory. In that Guna means chemical properties, Virya means potency, Vipaka means effect, right? Whereas Rasa means taste. Already we have discussed this one. Okay. Virya means potency, Vipaka means post-digestive effect, where Rasa means taste or essence. Next. The Hippocratic theory and Pythagorean theory found its origin in which of the following systems? Unani system, Homeopathy, aromatherapy, and none of this. We can make two options. One is aromatherapy and none of this, because they are not at all comes under the Hippocratic theory and Pythagorean theory. Yes, undoubtedly the theory is Unani system of medicine. Okay, Hippocratic theory and Pythagorean theory are the two important theory. The Hippocratic theory based on 4 humors. H. Hippocratic theory, humors. Pythagorean theory, proximate qualities. PP. Clear? Yes. 4 humors of body: blood, bile, blood, plum, yellow bile, black bile. These are the 4 humors. And 4 proximate qualities: hot, cold, wet and dry. These are the 4 proximate qualities of a body. So based on this theory, Unani system will works. Next question. Physician in Unani system turned as physician in the Unani system turned as pharmacist. No, because normally called as a pharmacist. Okay, doctor. No, not at all. None of this. So such type of simple questions. Okay. Yes. None of this is not an option. Doctor, we can never call a person who works in or who got his degree in the Unani system. Obviously, not at all. The right answer is Hakim. The person who practices the Unani system are known as Hakim. Okay, Hakim. And yes, the right answer is Hakim. Next question. Concept of proving and prover is related to which theory? Ayurveda, Homeopathy, aromatherapy and Chinese therapy. Okay. Proving and prover theory belongs to the Homeopathy. Okay, Homeopathy. Like in that Samuel Hahnemann. Okay. Samuel Hahnemann has performed an experiment called proving and proving theory. Proving means healthy person in this Proving means healthy person. Okay. Prover means unhealthy person or diseased person. Okay. For healthy and unhealthy person, he administers same extract, that is cinchona. Okay. Where the cinchona is an anti-malarial or antipyretic drug. So according to his theory, like use like, what he meant by like use like, the thing which can cause a disease, that can itself it can cure the disease, or else the thing or the any material or a plant or a drug which can cure the disease, it can able to produce the disease symptoms. So for that reason, okay, so he taken healthy person as a proving, okay, unhealthy person as a prover. So he administered the same extract of cinchona to the both persons. The healthy person has the symptoms of fever, but whereas the unhealthy person who is already having the fever gets reduced. Okay, so this is a theory of like cures like. Okay, like cures like, which can cures that can cause the same disease symptoms. Okay, yes, so this is the theory. So homeopathy, law of proving the drug produces similar symptoms in healthy person as those in the diseased person. Okay, so which of the following is not one of the element of Panchamahabhutas? Okay, Prithvi, forest, Jal and Vayu. Obviously, Prithvi, Jal, Vayu, Teja, okay, are the elements of Panchamahabhuta, but whereas forest is not at all option of the Panchamahabhuta. Okay, yes, Panchamahabhuta, Prithvi, Jal, Teja, Vayu and Akash. Okay, Agni, Prithvi, Jal, Vayu and Akash, these are Pancha Mahabhutas. And as I said that this is a theory belongs to the Ayurveda, Pancha Mahabhuta theory, Tridosha theory and Panchashila theory. Okay, yes. In which is no medicine metals used in Bhasma form? Obviously, Bhasma is Sanskrit term. Simple answer. Either Ayurvedic, Unani or Siddha or Homeopathy. Yes. The right answer is Siddha system. Okay, Siddha system. Bhasma form. You can see most of the things, okay, in the Siddha system only, okay, minerals and metals rich medicaments has been prepared from the Siddha system only. Okay, mostly because they are dependent on the minerals and okay, metals ions are they are frequently using for the preparation of the medications. Okay, and for that reason they convert them into Bhasma or Sinduram form. Okay, Operation Sindur. So that means they are converting them into, okay, Bhasma. Next, which of the following traditional medicine is a liquid dose form? Which of the following is a liquid dose form? Clear? Option A, Arka, B, Vati, C, Kalka and D, Avaliha. What is the right answer? Yes. Undoubtedly, option A is a liquid dosage form. Arka. Arka means distilled product. Arka means distilled product. Clear? Yes. Do remember this classification. This is also very, very important. Next, Punarnasava is an example of which of the following dosage form? The name itself will tell you Punarnasava. See, in the Ayurvedic dosage forms, I'll tell you one hint that, okay, prefix of the particular dosage form will be the prefix of the particular dosage form is the source of the plant material or plant name or the source, and suffix is the type of dosage form name. Okay, prefix is a plant name or drug name and suffix is the type of dosage. You can see Punarna Asava. The Asava means, okay, it is an suffix will indicates about the type of dosage form and it is example for the Asava. Okay, it's example for the Asava drug. Clear? Yes. So they undergo for the fermentation. So Arista and Asava are the, so both are alcohol containing preparations. Okay. Yes. All are Ayurvedic dosage forms except, simple, as we are a modern pharmacist, we can easily find out which one is a not an Ayurvedic formulation. Gutika, Lehya, liniment and Asava. Undoubtedly liniment is not at all comes under the Ayurvedic formulation. Okay, and these are all the formulations we have covered till now. Okay. Yes. Next, Lehya is also known as Arista, Avaliha, Asava and Kashaya. Okay, Lehya or Avaliha both are similar. Okay, both are semi-solid preparations. Okay, so Lehya is a traditional Ayurvedic preparation which contains semi-solid mixture and the prepared by adding sugar or jaggery. Okay, yes, known as Lehya or Avaliha. The herbal formulation which undergoes for the fermentation during preparation, Lehya, Gutika, Asava and Grutha. See, if you see this word or if you see alcohol, if you see any indefinite period of shelf life, okay, So, and undoubtedly your option will be this. Your answer will be this. Undoubtedly you can no opt that option. Okay. Yes. Asava. Yes, and to go for the fermentation. Both Asava and Arista. Both are undergo for fermentation to produce their self-generating alcohol, which acts as a preservative. Next. In Ayurveda, surgery introduced by which of the following scientists? Either Charaka or Sushruta or Galen or Dhanvantri. I said already. I said in the previous slides. Dhanvantri is known to be the father of Ayurveda, okay? But whereas Charaka is known to be important principle, okay? And yes, Galen is important first scientist, Galen, okay? But whereas Charaka is a important principle, but whereas the surgery is introduced by the Sushruta, and he wrote a book called Sushruta Samhita, okay? Sushruta Samhita, and he is known to be the father of surgery, and he performed lot of surgeries. Even at that time, he performed the rhinoplasty, no surgeries, and he done so many things. And treatises in Ayurveda. So, who are the treatises? Which means, what are the treatises? Which books or literatures? Charaka Samhita, Sushruta Samhita, both A and B, or Nagamuni. Obviously, so Nagamuni belongs to the Siddha system of medicine, whereas Charaka Samhita and Sushruta Samhita are belongs to the Ayurveda system of medicine. Okay, as Nagamuni is belong to the Siddha system of medicine. Which of the following are the part of Tridosha theory? It's a very easy and last question of this series. What is the last question and what is it? Yes, Vata, Pitta, Kapha are the three pillars of the Tridosha theory. Okay, yes, Vata, Pitta, Kapha. Clear? And yes, dear aspirants, these are the 30 questions from the topic called traditional system of medicines. Yes, for more such content, do subscribe our channel. And if you want more such type of content and classes, immediately do enroll in our courses by downloading the GDS app from the Play Store. Okay, and yes, start your preparation. Thank you and Jai Hind.